but they don't believe that there's HIV in Africa. HIV in Africa. Most of them have passed away, cause they refuse to heed the voice warning, when the voice of warning says.
Hello and welcome to this lesson. Remember, our previous lesson was on HIV/AIDS 1. Today's lesson is on HIV/AIDS 2, which is prevention of HIV/AIDS. The objectives for this lesson are: you need to mention the preventive measures against HIV/AIDS, understand how people are coping with HIV/AIDS, explain the ways of caring for people with HIV/AIDS, and also HIV/AIDS and stigmatization. What are the ways of preventing HIV/AIDS? Experts are still seeking a cure for HIV/AIDS, but the best way to stop the epidemic is to prevent it. Below are some preventive measures, which is abstinence. People who are not married should abstain from sexual activities. This will help to stop the spread of HIV/AIDS and even other sexually transmitted diseases. So people should abstain. Alright? We also have another measure here, which is faithfulness to one partner. Partners should be faithful to one another, as infidelity is a way to spread the disease. So people should learn to be faithful to their partners. Do you understand, students? We also have another way of preventing HIV/AIDS, which is the use of condoms. Using condoms reduces the risk of transmitting HIV/AIDS. Using condoms reduces the risk of transmitting HIV/AIDS. Do you understand? We also have avoidance of sharing needles, razors, and other sharp objects. Even injections. People should take their own clippers to the barbers. Are we listening? For their haircuts, no one should share sharp objects such as syringes, razors. Do you understand? Clippers. Do not share sharp objects with other people. It's a very big risk. We also have another measure, which is screening of donated blood. All donated blood must be screened for HIV before it is used for transmission. Now, blood found to be infected should not be used at all. Okay, we should learn to be careful. Okay, we also have another measure here. Pregnant women should get tested so that if they are found to be HIV positive, measures will be taken to prevent the spread of the virus to the baby. We also have sex education. The public should be enlightened and educated about HIV/AIDS and how to prevent it. Do you understand? We have early detection and control. If HIV is detected early in the body before it becomes AIDS, with medical help, the individual can live a healthy and normal life. So let's look at coping with HIV/AIDS. How do people cope with HIV/AIDS? Many years ago, a person who was diagnosed with HIV simply just waited to die. However, people living with the virus now can cope with the disease and live their normal lives. It is important to get tested, and if anyone is found to be positive, that person should seek medical help. The individual should take the medications exactly as prescribed by the doctor. Stick to the prescribed diets, avoid illness, get regular health screenings, and the prescribed vaccinations. How do you care for people living with HIV/AIDS? How do we care for people living with HIV/AIDS? Friends and relatives of HIV/AIDS should love them and care for them. Those around them should also treat them normally, care for them, and support them. Some of the medicines which they have to take have unpleasant side effects, so we should ensure this does not discourage them. Employers should not sack them because of their HIV status. Do you understand? Sometimes HIV/AIDS victims get frustrated because they feel it is a death sentence. So let us look at HIV/AIDS and stigmatization. Many times people living with HIV go through stigmatization. Some employers insist that their staff get tested at certain periods, and then those found to be HIV positive get sacked, which is not nice. Sometimes, if landlords discover a tenant is HIV positive, they become very frightened and send the tenant away from their property. So we should stop HIV/AIDS stigmatization. Do we understand? HIV is not a crime. It is not a death sentence. So people should learn to care for those living with the virus, assist them instead of the stigma. Do you understand? So I believe you enjoyed the lesson on prevention of HIV/AIDS. All right. So you can mention the various measures to prevent HIV/AIDS. Stop HIV/AIDS stigmatization. Do not share sharp objects or needles. Abstinence is very important. Do not forget that. Always go for regular checkup. Go for HIV tests. Know your status. Alright? Stay safe. And this is the end of our lesson. See you all in our next class. Thank you.
Stay alive for those who